Hello, this is Dr. Brandon Blood. I am back today to discuss the sacro-iliac joint. So, what is the sacro-iliac joint? Well, if you've been a patient in my office before, you know that this is one of my favorite joints in our body to work with from a treatment side of it, largely because the sacro-iliac joint can mimic a lot of different types of pain that can emanate from the lower back into the lower extremities. It's a joint that will not throw a positive X-ray or MRI finding usually, unless you have a condition called sacroiliitis. But otherwise, it's not commonly diagnosed based on imaging modalities that we may have been sent for by our other doctors. So, how do you diagnose sacroiliac joint pain? Well, let's first talk about what it is, and then we can talk about how a diagnosis can be made. So let's look at the structure of this joint that we're speaking of. Okay, so the SI joint is located in the lower part of our back, almost into our buttock area. So from an anterior view, this is our lumbar spine, our lower back, and it sits on top of our tailbone, and then our tailbone connects into this hip bone. So our tailbone, the scientific name for it is the sacrum, and our hip bone on each side, this upper part of it, is called the ilium. So this is the sacro-iliac joint. You have one on the right side and one on the left side. So let's take a look at it from behind. When we have sacroiliac joint pain, from a diagnosis standpoint, clinically speaking, we usually have patients that present with one side, usually one side versus the other. Sometimes it can be both, but it's usually pinpoint pain right at the base of the back and the top of the butt, and patients tell me, I hurt right here. Okay, so pinpoint tenderness is one way to commonly diagnose this condition from a clinical standpoint. Now, the gold standard for a true diagnosis of this condition is going and getting what we call a joint block, a sacroiliac joint injection, where a proper medical specialist, usually done at a pain management clinic, could be a pain anesthesiologist or a physiatrist, generally speaking, inject the joint with medications that help dull and numb the pain, and if your pain goes away, then the diagnosis is confirmed. Now, I usually don't like to jump to that route because oftentimes our clinical indications will help us make the determination that this is the condition that you're experiencing. So, other than pinpoint tenderness, one of the common symptoms that people experience with this type of pain is referral pain into the thigh. Okay. Now this shows pain traveling a little bit below the thigh. That can happen, but most commonly pain will come out of the buttock into the lateral part of the thigh or the front part of the thigh, and occasionally on the back side of the thigh. So this is a very common referral pattern of pain when we have SI or sacroiliac joint pain in the lower part of the back. So, from a treatment perspective, we have to figure out why the SI joint is not working and get it working. And oftentimes it's a combination between joint restriction at the actual joint and a combination of tight muscles in the lower back, tight hamstring muscles that attach into the lower part of our pelvis, and then gluteal muscles that are either tight or actually aren't working. So once we identify all the different problems that are going on that are creating this SI joint pain, then we can appropriately fix it. So I hope this informational video was valuable for you today and in explaining what the sacroiliac joint is and how it can give you pain. If you'd like to leave us feedback, if there are any other symptoms or conditions that you would like to get explained, just leave us some feedback and we'll be happy to do that for you. I hope you have a wonderful day.